All right. Assalamu alaikum, everyone. Thank you for joining our webinar. We will get started right now. And we are live on YouTube at Noor Ohio for those asking. All right. Assalamu alaikum. Peace and blessings be upon you all. Welcome to our webinar. My name is Noor Al-Huda Al-Hashim. I am the director of the Health Literacy Program at the Noor Islamic Cultural Center, and I am honored to moderate our webinar tonight and host our speakers. As Muslims, we have long allowed the stigma surrounding mental health to create a barrier between our spirituality and our reality. Though we have made tangible progress in this area, we are really just getting started. The Health Literacy Program aims to promote healthy lifestyles and health education, and our work would be incomplete if we failed to address one of our community's most needed topics. We're thrilled to have this amazing lineup of speakers tonight. We have Ihsan Rodriguez, Kenza Asif, Dr. Amir Shah, Chaplain Khurram Ahmed, Dr. Fatima Chaudhry, Nisiba Aiden, and Dr. Samira Ahmed, who will be joining us later. Each of these professionals will be sharing their expertise with you in what we hope is the first of many mental health-related events. We plan to showcase to you what a strong mental health line looks like and where we fall on it as providers and beneficiaries. We will do our best to dedicate the last 15 minutes for your questions and comments, so please share those in the Q&A box, but please refrain from sending personalized cases or private information in the chat. Without further ado, I will start by introducing our first speaker for tonight. We have Sister Ihsan Rodriguez. She is a third-year PhD student in clinical psychology at OSU with a focus on health. She is currently in training and conducting therapy. Her research is on the interrelationship between medical health and mental health, and she's interested in improving the quality of life for individuals dealing with the burdens of chronic illnesses. Her community involvement includes supporting emotional wellness for Muslim students, grief support for community members, increasing awareness of the needs of Muslim clients who are seeking therapy, and helping make the field of psychology more inclusive for individuals from underrepresented backgrounds. Thank you for joining us, Ihsan, and the mic is yours.
Thank you so much, Noor. Assalamu alaikum, everyone. Welcome to the Mental Health Line. So as Noor told you, I'm currently a student in the clinical psychology program. And so I'm going to be speaking on the role of a psychologist in the mental health lineup overall. But I've not yet finished my program, so I'm not quite a psychologist yet. Okay, and so for the first question, what does it mean to be a psychologist? Well, right now I'm studying health psychology at OSU, and I'm about halfway through my program. I have 3 years left. So studying health psychology, there are two components to that. There's the psychology component and there's the health component. And so I'll talk to you about those separately and kind of merge them together so you get a sense of what that means. And so as you all know, psychologists treat and study mental health conditions. But psychologists are unique in that we really focus strongly on assessment and diagnosis. And so you might think of how a medical doctor, you could go to them with stomach pain, and stomach pain could be a symptom of many different illnesses. And so it's up to them to differentiate and diagnose which illness this stomach ache is a symptom of. And so similarly, the fact that we focus on assessment and diagnosis means that we're quite good at differentiating between what your symptoms could be related to and what condition you might have underlying those symptoms. We focus a lot on individualizing treatment, but we're going to do it through therapy. So psychologists do not prescribe medication, but we do provide specific and individualized therapy that's focused on problem solving. And any psychologist that you might go to should be culturally competent. That means if you come to them from a specific culture or with specific religious values, they should be able to adapt therapy to those needs and to those values to the extent that it's important to you. And maybe it isn't important to everyone, but for those who it is important for, they should be able to adapt therapy, and that can usually support even better outcomes for the client. And next, I'll talk about the health piece. So where does health psychology come in to the therapy room and to the treatment room? Well, therapy goals can include a variety of things like low self-esteem, eating disorders, feelings of loneliness, and so many more things. It can also include your medical health. And so when you think about your medical health, you might have some kind of a lung disease. Let's say you have chronic obstructive pulmonary disease and you have shortness of breath. Every time you get out of breath, you might think, well, I shouldn't feel this way. I should have more energy and more breath. And so that might make you angry. And that anger can lead to muscle tension, which leads to negative thoughts like I'm never going to get better. This can heighten anxiety, and we know that anxiety can be related to shortness of breath, which then again leads one to experience shortness of breath or dyspnea. And the cycle just continues between the medical illness and the symptoms of medical illness and one's thoughts, feelings, and behaviors. And so a health psychologist can try to step in to the middle of this kind of vicious cycle that's unhealthy for the individual and try to get them to reduce some of these negative thoughts, negative feelings, and negative behaviors like the muscle tension. And in that way, health psychology is really quite holistic because health psychologists will not just treat your mind, but also your body as well as one integrated whole. And really look at how your medical condition is impacting your mental health functioning and vice versa, because we know that this is a cycle. And so health psychologists will help an individual by helping them to meet their physical or medical health needs and their mental health goals simultaneously. And again, all psychologists have to be culturally competent. And that means taking into account your cultural and religious values to the extent that you feel it's necessary, they should feel that it's necessary as well. And health psychologists also participate in assessments, but they also have to assess your medical needs as well as your mental diagnoses. So let's say you're coming in for weight loss and you are struggling with fatigue and difficulty controlling the amount that you eat. They would look at all of those things and help you to manage the symptoms of the weight loss, as well as the unhealthy thoughts, like maybe guilt or shame, emotions like guilt or shame, and the unhealthy thoughts like I shouldn't be doing this, I should be better than this, and the unhealthy behaviors like oversleeping and forgetting to exercise. So they would help on all of those levels. And we even help with other areas that are causing distress, like courtship and relationships. If you have a romantic goal, psychologists can help you to remove some of the stress that you feel around pursuing those goals. And so whatever is causing you distress, going to a psychologist would be a great idea because we are here to support you. And so how does one become a clinical psychologist? Well, the career path is pretty steep. The clinical psychology program itself is quite competitive with about 1% of applicants accepted, but this isn't the only road to being in the field of psychology. And because the path is quite challenging, it's really important to have a great mentor. And I can say that I had several great mentors, starting from my undergrad, getting close to professors who can help you to mentor you and tell you kind of the secret formula for how to get there. And I'm going to give you the secret formula as well. If you want to follow up with me, I would be more than happy to help give you more information. So it might be helpful to start with a bachelor's in psychology, whether that's a bachelor's of arts or a bachelor's of science. And you want to emphasize taking courses like statistics, research methods, and psychology-related classes like intro to psychology, abnormal and developmental psychology. You also want to have research experience, whether that's in a psychology lab, a medical lab, or both. You want to make sure that you can come into the program with having research experiences under your belt and show that you have a research interest. You also want to have some kind of experience that is related to clinical or therapy-like work. And so one thing that I did was I volunteered at a suicide prevention line for quite a bit of time, but there are many other opportunities. For example, working with individuals who have an intellectual disability if you're interested in pursuing intellectual disability track. You might also learn mindfulness training if you're interested in pursuing mindfulness in clinical psychology, many other things you can work on. And know that the clinical program emphasizes an interest in both research and therapy. So if you're an individual who is interested in both of these things, then the clinical program may be of interest to you. And finally, this program is about 6 to 7 year longs. And so the last year you'll spend doing some kind of an externship, which is an internship that tends to be out of state just to get extra experience in the specific area that you want to work in. And finally, you'll have to take a licensing exam. And so how do I see layman partnering to help build the mental health line? I think there are several ways that the everyday person could help to build the mental health line, and two main ways. The first is to practically support Muslims receiving competent care. And the second is to help understand the intersection of health psychology and Islam. And so to practically support Muslims receiving competent care, it's so important that all of us participate in providing a safe and non-judgmental support for Muslims to help them seek help as needed. And so sometimes we don't notice, but even the conversations we have around the kitchen table can be off-putting for individuals who need help and don't know how to reach out. And more than likely, there are some people in your life who are in need of services, and they may fear being stigmatized and being judged. And each one of us is responsible for conveying an attitude of support for those around us, because individuals who are younger than us are learning from us. There's a lot of learning that's happening even at the dinner table. So we have to be aware of what our own attitudes are and how to foster an attitude of acceptance so that individuals feel that they have the support they need. Another important aspect is to help increase education for interested treatment providers. And so if any of you are seeking mental health services, it's important to not be shy to say, you know, this value is important to me. Maybe it's a religious value, maybe it's cultural value, or both, and say, this is something that I need in my therapy. Do you feel that you are someone who can provide this care? And this can help to spread an awareness and education among treatment providers that these are some of the needs that community members are hoping to have met. And finally, I would say the most important thing is probably just increasing self-education for Muslims about mental health, risks, warnings, and signs. We all know kind of some of the signs of having a heart attack. You have chest pain, you have certain discomforts. And so similarly, it's important to know when your mental health may be at risk and you may need more support than you can provide by your normal activities. And so in terms of the intersection of health psychology and Islam, I believe it's really important that we as Muslims have really good education on how our religion plays a role in our health so that we can also optimize our health that way. For example, Muslims with type 2 diabetes often fast Ramadan. And of course, we want to encourage fasting as much as possible, but we want to encourage when is it safe, and we want to support individuals fasting when it's safe. Some of the research shows that it is safe for some individuals with type 2 diabetes to fast Ramadan, but for some, it also is not. And we know that the Quran gives exemptions for those people. So we want people to be educated enough to know about how their health condition is impacting their practice. We also know that from research, there are many benefits of fasting and making salah. So how do we maximize those benefits so that our prayers are really counting as maximizing our health the way they were intended? And then last, one thing that's important is to help understand how stigma and discrimination that we experience as Muslims may be related to other types of our health, like long-term health and chronic illness related to cardiovascular health? And how do we reduce these negative impacts of discrimination and protect Muslims from these negative health impacts that come from discrimination? And one way would be, religious coping has been shown to help reduce the negative impact of discrimination on our long-term health, but it's also helpful to see a treatment provider whenever it's necessary. Thank you so much.
Thank you so much, Ihsan, for that amazing content. And she will be sticking around to the end of the webinar for those who have questions about psychologists' role on the mental health line. So thank you. And we will be moving forward to our next speaker, who is NICC's very own Kinza Asif. Kinza has been a resident of Columbus, Ohio, and an active member of the NICC community since 2009. She attended The Ohio State University for both her undergraduate and graduate degrees, earning her master's in social work. Kinza is a licensed social worker by the Counselor, Social Worker, and Marriage and Family, I lost my notes, and Family Therapist Board of Ohio as of 2017, and is working towards her independent licensure. Kinza has about 5 years of social work experience in nonprofit, community mental health, and school settings. She has done advocacy work with domestic violence and sexual assault victims and currently works with children and families experiencing behavioral and mental health issues as a counselor. Finally, she is a member of NICC's Muslim Mental Health Line initiative and dreams to see a healthier and happier community, inshallah. Thank you, Kinza, and the mic is yours.
Thank you, Noor. Thank you for that introduction and for Ihsan for your content. And to all the speakers and organizers here today and everyone joining, thank you. Jazakallah khair for being here. Assalamu alaikum. One of the objectives of the panel tonight was to learn about different professionals that are part of the mental health line. So to that end, I'll be sharing about social work. Let's get started. Bismillah. So to start, the field of social work is very much guided by certain ethics and core values, which I appreciate because I wanted to be in a profession where I could still practice my beliefs and just have that be a part of my day, my day job and everything. So there is a code of ethics that all social workers learn about and follow, which you can find at that website listed there. But the main mission for social workers is to enhance human well-being and help meet the basic human needs of people, with particular attention to the needs and empowerment of people who are vulnerable, oppressed, and living in poverty. And if you want to just kind of say that in one line, social workers help people solve problems and cope with them. So that could be figuring out small things of like how to access a resource or to cope with problems, all the way to another extreme for people who are so far gone, like they think they want to take their own life. So there's a lot to be done. So the main 6 core values are service, social justice, dignity and worth of a person, importance of human relationships, integrity and competence. And those kind of speak for themselves. As social workers, we are committed to serving our community. We're committed to social justice. We want to see everybody have, the same access to things and opportunities. Every human being, no matter their background, has worth, has dignity. The field of social work is very much dependent on human relationships. So whether that's with your clients or other colleagues, building those is very important. Integrity, so you have morals and ethics, you act morally. And competence, we want social workers who are educated, able to do their job and do it well. So people are getting quality care. And then some of the ethics that kind of drive our work are safety, confidentiality, self-determination, cultural awareness, and consultation and collab supervision. Safety, of course, the first kind of premise is to not do harm. If you're going to do anything to begin with to help someone, try not to do harm. Confidentiality, so, you know, we protect our clients' information, you know, we don't share that unless they've given us consent. If I bring up a story, I'm gonna not mention a name, not mention any kind of identifying information. So much like in the medical field, it's protected health information. Self-determination is really important. When you're working with a social worker, it's a collaboration. It's not someone coming in and telling you what to do. You know, so for Muslims, that's really important. For example, you know, we have certain values and things that we adhere to, and so when we're in treatment, we would not want to have to compromise that. And I'm just, as like an example, you know, a woman who's experiencing abuse might not want to go to a shelter because she can't practice her faith there, but as her social worker, you know, you could advocate for her and explain to her that, no, yes, you can, and we can try to make sure that your values are honored there, whether that's like, if it's Ramadan time, you need to be up at a certain time and be able to eat, things like that in the shelter. Cultural awareness, so it's kind of called cultural competence, but I like to use the word humility, so you kind of are aware of other people's backgrounds, but at the same time, you're looking at them as an individual within that too. So being able to serve people of different backgrounds is important. And then the last couple of things, it's no matter how like long you're in the field, you're always going to be consulting with other people. You might do case presentations, and if there's like a client you're struggling with, you're going to go to other people. You're going to collab with other organizations, other professionals. A lot of multidisciplinary work will probably happen. And then supervision, there's always supervision. You know, right now I'm working towards my independent licensure, so I have to meet with my supervisor once a week and talk about cases and learn skills. And so that's always ongoing as well. And it's just, again, so that we're competent and we're providing the best possible care. So what do social workers do? It's really broad. I think when you ask someone, or you just ask them to give their like first impression or thoughts about a social worker, you know, they'll be like, oh, that's the person coming to take my kids. Or I think in my background as like a DESE person, it's just someone who does like charity work. It's not really like a professional thing. So part of us having that code of ethics too is to give the field professionalism and to like let people know that social work is a professional field. So that code of ethics will also have guidelines on how we deal with clients, how we deal with our colleagues, and how we kind of present our profession. As far as what they do, if you're a social worker, you can do macro work, which is very with individuals or with families, kind of at that small, not lower level, but more personal level. And then macro level would be like if you are running a program or doing policy work or things kind of at the outer level. You can be a clinical social worker, so you're doing mental health treatment, assessing, diagnosing, or non-clinical, which is other things like, for example, I was an advocate with the domestic violence victims, so I wouldn't really work on the mental health piece, but I would do other things for them, like advocate for them in legal settings, or just helping them get connected to resources so they could get out of their situations, get to a safer place. And then there's case management. No matter what type of social work you do, where you do it, there's always going to be a case management piece, I think. The best way I can think to describe this is through an example. So if you think of maybe a child who's experienced abuse and he or she is being removed from the home, you know, now they're kind of part of the foster care system, so they have some legal things going on. They might have things at school happening. They might have medical needs, mental health needs. So they just have a lot of different systems playing a role in their life. And so like a children's services caseworker would kind of be the person managing all of that, helping that kid, you know, access all of those systems and deal with them. And then do a lot of crisis intervention. That, I mean, really, it's whatever the day brings. And that's when you kind of put everything else aside and you go to the person who's in crisis. You know, they might be someone who's actively suicidal, they might be in a violent situation and they need help getting to a safe place, just anything like that. Social workers do case notes. You have to document everything, so that there's a record of what's being done with clients. It's not just kind of willy-nilly going out there. And that's also if other people take over, you know, they know what's been going on, things like that. Obviously, you can do counseling and therapy. You're always going to be providing emotional support. You're meeting people who are probably experiencing one of the low points in their life, so they need emotional support along the way. That's something you'll always be doing. And then if you go further in your education, you can do research and evaluation projects. So we're really big on evidence-based practices. Again, trying to bring more professionalism to the field. And that's kind of a summary of that. So where can they be found? Really anywhere. And this is kind of what drew me to social work, because there was so much variety. I'm kind of not the person who can sit down and do the same thing every day. So you're really anywhere: schools, hospitals, nonprofit, military, government, like the world is your oyster. If you're interested in working with a specific population, that's an option. So there's like immigrants or abuse victims, veterans, children, like really anything. Or if like a particular issue really speaks to your heart. Mine was always family violence. It was one of those things that just really riled me up. So you can pick on that way as far as if you wanted to kind of choose where to go within social work. So there is no shortage of things you can do. And so thinking of where social workers are found on the mental health line, I feel like it's anywhere. You could be on one end doing like awareness prevention work all the way to treatment and intervention. So really anywhere. If you think of the line being wellness to illness. And also because we are trained to really look at the person within their environment and look at things in depth and with breadth. So really, you find them anywhere. So to become a social worker, you do have to go to school. If you do your bachelor's in social work, you can probably do work as a case manager. It's more general. You'll probably be meeting clients, assessing their needs and linking them to where they can get help, kind of that first stop. If you do want to do more clinical work or provide like counseling, then you'll need to go and do a master's, which is a further 2 years in a graduate program, or 1 year with a bachelor's. At least that was the case at Ohio State where I went. So you'll want to look into where you live or where you want to go to school for those specifics. But if you do get your master's, you can practice independently. You'll be doing field work. So you'll be, they'll help place you like with an agency to do internship hours while you're in school. My particular program also had a capstone project. So we had to like write a research evaluation paper of like a program or practice at one of our agencies just to get that experience. And then you can go further and do a PhD, do more research and things. When you're in the program, some classes you might take would be about like human behavior and development. So you might learn about like social welfare policy. So like how it started out during the Depression era and how it's changed over time. Foundations of social work practice was pretty fun. You had to take a class to kind of start learning therapy skills, and so you had to record yourself and kind of see how what like your body language was, analyze yourself, like how open is your body language when you're doing like a pretend therapy session. And you can pick certain tracks. So if you are interested in working with youth or like in addictions with elder people, things like that. You'll learn about mental health diagnoses, yeah. You can do that. And then there's classes to learn about how to develop programs, what goes into that, how to plan for those. So a lot of different things. And then once you're done with school, you do have to get licensed. And I'll speak for the state of Ohio because that's what I'm more familiar with, but you'll want to look into that for your own state if there's people outside of Ohio here. So in Ohio, we have the Counselor, Social Worker, Marriage and Family Therapist Board. You take an exam to get licensed. And then you do have to do continuing educations, about 30 hours over 2 years to renew that. And then once you have the LSW, which is what I have currently, so I'm working towards my independent licensure, you need to be working 2 years full time and have 150 hours with a social worker who has that supervisory designation, the next step. And so you'll be getting those hours in over the 2 years and take another test. And then once you have that independent license, you can go into private practice and do your own things if that's what you'd like, or obviously other opportunities open up for you. So to be a good social worker, these are just some things I came up with. Really, really flexible. You have to be so flexible. I think my time is running out. You know, I often came into a day and I would have something in mind and you would have to completely throw that out the window because, you know, a crisis came in. To be empathetic, compassionate, of course, an active listener, you reflect what people say, you validate them. Discretion is important, especially for that confidentiality piece. Because we don't want to accidentally share information that's not supposed to be shared. You got to be assertive and have good boundaries. I know I've had experiences where, because you're going to work with people who maybe haven't learned boundaries because of the things they've experienced. So you have to be assertive with yourself, and you got to be assertive because you're speaking for people who might not have a voice, ever have had a voice. So that's something that I've really gained at being a social worker for the last couple of years. You got to be tend to yourself, do some self-care, be intrinsically motivated because it's heavy work. If you don't take care of yourself, it's really difficult to keep doing it. What time here? Let me go through real quick. So some of the pros and cons. It's really rewarding work. You know, when you see your clients come out the other side doing really well, you're like you're their cheerleader. That's really special to me when I see my clients do well and they're just happier and more healthy. The Prophet ﷺ encouraged us to spend time with people who are in need. And I think it's really humbling and it keeps you kind of grateful for what you have. I like the variety. I think the job looks really positive. You know, it's not something that robots can kind of do. It's very human work. On the negative side, there is a lot of compassion fatigue. It is heavy work. You're going to be doing really emotional triggering work. You're going to see people at their lowest points. You're going to see suffering. So that leads to burnout and turnover. It's not as prestigious as a career. You're not going to get paid as much, but it is rewarding. So you really need to have that intrinsic motivation to do that. Since I think we need to move on to the next person, I will let them go over kind of the differences here because they'll be talking about their field. So I'll finish up here. Thank you, everyone.
Thank you so much, Kinza, for that content. We're very thankful to have you on the mental health line. We will be moving forward to our next speaker. We have Dr. Amir Shah. Dr. Shah completed his psychiatry residency at Cleveland Clinic and fellowship in psychosomatic medicine consultation liaison psychiatry at University Hospitals Cleveland Medical Center. He is currently the attending psychiatrist in the Medicine Psychiatry Unit and interim medical director for Emergency Psychiatric Assessment Services at University Hospitals Cleveland Medical Center. He's an assistant professor at Case Western Reserve University School of Medicine, and he has vested interest in working with our leaders and scholars to improve services within the Muslim community. We're very happy to have you with us today, and the mic is yours.
All right, Jazakallah khair. Share my screen quickly. Bismillah walhamdulillah, salatu wassalamu ala rasulillah. Assalamu alaikum wa rahmatullah. Thank you for having me, Jazakallah khair, for having me on this wonderful panel. And I hope this is a benefit for everybody listening. I'm here talking about psychiatry in the mental health line, and have some objectives here. Just what the role of a psychiatrist is, the road to our practice, and then as a community, as an individual, how to engage and contribute to our field and to the mental health line in general. So the crude dictionary definition of psychiatry is the study and treatment of mental illness, emotional disturbance, and abnormal behavior. I add to this, and for psychiatry specifically, biological treatment, taking into account psychological and social circumstances. And as Sister Kinza was about to allude to, some of the differences between various specialties, a lot of times people have the question of what is different between psychiatry and psychology. So I start with the similarities, and that's that both fields, experts in mental health, and both fields conduct psychotherapy. And within psychotherapy, there are many modalities, and it really depends on the condition that the patient is presenting with, then we can derive a certain modality for those patients. As far as psychiatry goes, as you see there in the diagram, I actually refers to medical treatment. So there is a concentration on biological treatment. Psychiatrists graduate from medical school, it says medical doctor, MD or DO. Psychiatrists assess both mental and physical aspects of psychological problems and conduct and prescribe medical treatments. And some of the procedures include things like transcranial magnetic stimulation, ECT, in the most severe cases. As far as where psychiatry falls on the mental health line, or on the health line in general, pretty much the whole spectrum. Primary care, psychiatrists are involved in collaborative care models. This is a fairly new development over the past decade, where psychiatrists have been embedded in primary care physician offices, in specialty clinics, so that patients have quick referrals and are able to be treated in a shorter amount of time, or at least be assessed in a shorter amount of time. There are also community mental health centers. There are a number of them up here in Cleveland, wherein there's a psychiatrist, primary care, physicians, nursing, social worker, case managers, all located within one building. And there are huge advantages for our patients that are otherwise unable to obtain care. Psychiatrists also take referrals or consults, and the referrals can be sent in by almost anybody, but mainly by primary care physicians, counselors, psychologists, social workers. Anybody who feels that their client needs additional medical treatment or medical care, or at least further assessment, can send their client to a psychiatrist. I have also listed specialty care, such as tertiary or quaternary care. This is the academic centers. And this is where you'll see most psychiatrists apply their fellowship training. And we'll get to that in a bit. And the last one I have listed here is emergency care. And this is unfortunately where many patients are encountered. And what I really want to mention here is that the course of the illness is at its most severe when somebody presents to the emergency room. So a lot of work is done to counteract the illness, to address it, to reverse it. And all that work can be accomplished with preventative or early treatment, and at the very least, early recognition. And I'll get to that in a little bit as well. As far as our career path, so there are undergraduate studies, which include a bachelor's degree. I myself have a Bachelor of Arts. You can get a Bachelor of Arts or of Science. And the major does not have to be actually a science major. As a proud Buckeye, my major was International Studies, and medical school requires prerequisites. Thereafter, there are 4 years of medical school. During high school and undergraduate, as Sister Ihsan had mentioned earlier, it's essential to have mentors, advisors, to help along this path, and to really to guide you to what you desire to do, what your passion is, as opposed to just a straight shot into whatever it is you think you have to do. After medical school, there are 4 years of graduate medical education, that is residency. And during this time, physicians can get fully licensed. And after that, have the option of doing fellowship as well. The fellowships are 1 to 2 years. And they include specialties like child and adolescent psychiatry, consult liaison, or psychosomatic medicine, which is what I did. Forensics, geriatrics, addictions, sleep medicine, pain management, and also neuropsychiatry. And then there are some career options, and those in part depend on what setting a person would like to be in after graduating residency, whether it would be strictly community, outpatient, inpatient, emergency, or specialty practice. I have my own personal opinions about what I'd like to do for myself. However, sometimes a mix of all of these settings can really help a psychiatrist become really well-rounded and be of more benefit to their communities as well. So how can one engage and learn about what it is, or how to get to a psychiatrist? How as a community can we encourage people to seek preventative care or address issues as they come up, as opposed to on the tail end? The first thing here that we have, as is always mentioned, is navigating stigma. And this is actually the most difficult thing to do, especially with our communities. And education is key on this, not just education on mental illnesses, but education on our own history, on how great physicians in Islamic history have emphasized mental health care. So we talk about people like Imam Balkhi, Ibn Sina, Ibn Rushd, how this knowledge translated to other mental health care providers or physicians, like Ibn Maymun, who then, whose knowledge is used by his Jewish community. And whether or not we agree with the ideologies or methodologies of certain people in our history, the fact of the matter remains that mental health care was important regardless of what community they were in. And the emphasis put on it was an important thing for us to study. And there are some great resources we can get to and provide in the future, inshallah. So, contacting somebody on the mental health line, whether it's a primary care physician, counselor, supportive community members, such as your imam, some of the shuyukh that might be supportive of you, other people such as chaplains and we'll get to that in a second too, inshallah. You know, anybody who you feel can provide you with some support. Just getting in contact with somebody is the first step. Initial recognition of signs and symptoms. I have this here mostly for family members of people who are suffering from mental illnesses or who may be at the beginning stages of it. Sometimes changes in behavior can be the first sign of a more serious issue. Even things such as changes in sleep pattern, whether it has to do with you know, substance use, just mood disorders, I shouldn't say just, but mood disorders, anxiety, whether it's a current stressor that is just, you know, at the time, something very fleeting versus something more persistent. So initial recognition of signs and symptoms by close people to that particular person. And the last thing here, at the very least, be supportive if somebody confides in you. Know when to refer somebody to a professional. A lot of times people will use lines like, get over it, you know, it's not that major, you'll pull out of it soon. Those things can be helpful at times, but not necessarily helpful in the long run. And those statements also enhance stigma. So so those are some ways that people can engage and learn. And with that, thank you. And I know this was a little bit shorter than the previous presentations, but I'll be around for questions, inshallah. Jazakumullah khair. Assalamu alaikum.
Jazakallah khair, Dr. Shah. We are happy to have you and thank you for that content. We will be moving forward to our next speaker, Chaplain Khurram Ahmed. Chaplain Khurram Ahmed serves as a community and crisis chaplain in Central Ohio. His training and professional engagement in healthcare chaplaincy has taken him across major health systems in Los Angeles, California, Columbus, Ohio, and Stony Brook, New York. Khurram holds a Master's of Divinity in Islamic Chaplaincy from Bayan Islamic Graduate School, and ecclesiastical endorsement through the Islamic Society of North America. We're very happy to have you with us today, and the mic is yours.
Assalamu alaikum wa rahmatullahi wa barakatuhu. Bismillah, alhamdulillah, wa salatu wa salam ala Rasulullah. Is my audio good? You can hear me well, I hope, inshallah.
Yes.
Sounds good on my end.
Great. So inshallah, let's begin. So these are the 4 points we're going to cover as I kind of introduce chaplaincy to you. The role and function of the chaplain, what's required to become a chaplain, our role in the Muslim mental health line, and what are we, some kinds of imams or therapists. So first and foremost, the role of a chaplain. A chaplain serves as a religious leader in contexts where an individual is separated from her community or is part of an institution that positions itself as secular or diverse, where the settings or circumstances lend themselves to triggering spiritual distress. So that's why we see chaplains in many of the same places that we see social workers, like prisons, colleges, universities, hospitals, the military. So many hospitals, for example, have a history of being born out of some connection to a religious tradition, Ohio Health being Protestant Methodist or Mount Carmel being Catholic. And that says something about their commitment to diversity, honoring religious values of others, their staff and their patients, to the point that they will hire Muslim and Jewish and Buddhist chaplains. But this does not mean that a Muslim chaplain who works at Mount Carmel is, is kind of a Catholic, right? Still a Muslim chaplain there to perform the roles and services and the requirements that you would expect a Muslim to fulfill, even if they're not at a Muslim institution. But in some instances, we have chaplains, and this is an emerging trend, that chaplains are on staff at masajid, or more commonly that you have an imam or an assistant imam who has some training as a chaplain. What's important to, I guess, know here is that chaplains develop expertise based on their context, right? A prison chaplain will make sure, will work to see that the Muslim incarcerated population has specifically Friday afternoon available for Jummah. So it can't be, right? It would be unfair and in America unconstitutional for a prison to decide everybody gets 1 hour of religious, communal congregation gathering time at 10 a.m. on Sunday mornings, right? That wouldn't work for the Jewish community. It wouldn't work for the Muslim community. That would privilege the Christian community. So navigating these kinds of things in that context is something that a chaplain that works in that role would have the skills and the tools to articulate. A healthcare chaplain who's working in a cancer center would develop some understanding of symptoms and challenges that are related to specific diseases. A healthcare chaplain who works in a ALS clinic, Lou Gehrig's disease clinic, or a multiple sclerosis clinic, which are very devastating diagnoses and devastating diseases, will probably have a lot of conversations around suicide, right? That's just your environment and your circumstances and what you come in contact with, developing those tools and that training and those muscles. A campus chaplain would have probably a big part of their responsibility would be to understand what homesickness means and how to process that for communities, but also have the conversation with individuals about how to navigate and overcome those difficulties. Next, we'll briefly go over the training that's required to become a board certified chaplain. That is a nationally recognized chaplain, right? So after you have your four-year bachelor degree, you have a 3 years master degree, a master's of divinity degree, which in my case includes courses on Islamic law and ethics and Quran and Sirah. There's material related to interfaith work and intrafaith work within the diversity of the Muslim population, as well as counseling different populations, people with specific illnesses, or the youth or the elderly, as well as grief and bereavement training. The next step, well, not necessarily the next step, the next one on the slide, people can do it in any order they like, is to do 1,600 hours of clinical training, of which 1,200 hours is direct clinical work, where you're seeing what we call care seekers. In the hospital, it would be a patient. In the military, it would be service members, as well as 400 hours of direct and group supervision. After that, you have 2,000 hours or 1 full year, full-time, of documented work post-clinical training. You need to be endorsed from your faith group. As was mentioned, for me, it's from the Islamic Society of North America, from ISNA. And what that means is that you can write to ISNA and ask them, who am I? Am I in good standing? Am I responsible? And they would, I've already interviewed with them, and through the process, they affirm that I'm, not teaching or sharing strange, heretical, non-Islamic material. I am, inshallah, a person from the Ummah of Rasulullah sallallahu alaihi wasallam. The next step is to become board certified, is to actually do the application, write your essays, and pass an interview, and then remain in good standing with your endorsing and certifying bodies. Excuse me. There we are. So the Muslim mental health line role. And before we get to that, I want to take a minute to talk about wellness or illness. and where we are on the spectrum and what that means a little bit. Right? Is that I'll say that neither wellness nor illness is a permanent state, right? That we all suffer loss. It is an inescapable reality of the world that Allah has created for us. Wal asr innal insana lafi khusr. Loss is inevitable. We are in a state of loss. Being well or being unwell is natural and inevitable, and there's no shame in it. Right? But what we need to do is to develop as individuals and as a community resiliency, which allows us to stay motivated when we are faced with adversity. Like as we're seeing right now, a pandemic, racial injustice, poison politics, all happening at once. I can share that during my time in a hospital, I would come across Buddhist patients at the time of their death when death was very, very close, when it was, really close in the last hours, they would have instructions to stop pain medication. And the reasoning, as I understand it, is that from their tradition, it was no longer suffering, that they were in immense and excruciating pain, but they weren't suffering. It was meaningful to them. It was cleansing. It is part of, the ripping off of a Band-Aid or a kind of sudden awakening, that it is part of a journey that is uncomfortable, but it's beautiful and meaningful to just bathe in that pain and in that moment, right? So yes, tremendous pain, but they would say not suffering. I think a chaplain can play multiple roles in the Muslim mental health line, whether it's in prevention, and two examples of this would be developing tools and strategies for resiliency and coping, as I mentioned earlier, but also being aware of the signs of burnout, depression, anxiety, and suicide. And there is so much more, right? Just to give you a couple of brief examples. And in the intervention stage is to offer immediate support to the affected, to those that are affected directly and those affected by the ripple. And what I mean by that is that we have someone who falls very ill, who gets a cancer diagnosis, for instance, and then we have their family and how it's impacting them. In addition, because of circumstances, the oncologist might be very deeply affected by this specific patient for some reason. Maybe it reminds them of their mom or dad, right? And so it just becomes a very difficult patient for them to care for. And maybe for the similar reason, it could be very difficult for the social worker as well, who's working on the case. So there's support for not just that patient, but the family and the staff, the team that is around that patient, right? And then secondly, I would say ongoing support to process loss and trauma. And so finally, my last slide is, so are imams like chaplains or therapists? What do we do? I want to say that this is very uncomfortable for me to speak about, because I don't like to speak about the roles others play. I don't like to say that imams or therapists don't do these things and don't have this expertise. I have learned too much from too many people who carry the titles of sheikh and imam with dignity and character, that I don't want to say anything that's going to be interpreted as criticism. May Allah preserve all those who have chosen to study the deen for the benefit of our community. But a colleague shared this message from somebody who is far more learned and knowledgeable than I am. As a mufti, my role is to give individuals legal guidance relevant to their specific contexts. When I am the imam at the masjid, my role is to preach to them my interpretation of what our faith tells us to do. When I'm a chaplain, my role is to be a compassionate and supportive presence through the hardest days of their lives. So I will let that speak for me, right? But I'll say that with a chaplain, you will get a calm, non-anxious, non-judgmental presence. You will not get preaching or da'wah, and you will not get advice unless you ask for it. That is not the primary role of the chaplain. And my request or my challenge to those who are listening, who are interested, is that if you're curious to really experience the difference, is to speak with an imam and speak with a chaplain, and inshallah there will be benefit in both exchanges, but there will be different exchanges. So that brings me to the end of my presentation. Thank you so much for listening. May Allah bless you all. Assalamu alaikum wa rahmatullah.
Jazakallah khair, Brother Khurram. That was such enlightening content. Thank you for sharing your professional perspective. We already have some questions for you, and like I said, we will address them towards the end of the webinar. And I would use this halfway spot as a reminder for our attendees that you can send your questions through the Q&A box. Please make all the questions confidential as much as possible. We will address them to the best of our ability in the last 15 minutes or so. With that being said, we will move forward to our next speaker. We have Dr. Fatima Chaudhry. Dr. Chaudhry is a board-certified internal medicine and geriatric medicine physician. She received her undergraduate bachelor degree in occupational therapy and worked as an occupational therapist at the Cleveland Clinic. She then attended medical school at Wright State and earned her medical degree there. And she completed a 3-year internal medicine residency at Riverside Hospital. And after a 15-year career as a hospital physician with Ohio Health, she completed a fellowship in geriatric medicine and currently works with MedOne in the post-acute care setting and assisted living since January 2020. Dr. Chaudhry, we're very happy to have you with us today, and the mic is yours.
Assalamu alaikum. First of all, Jazakallah for having me. And Jazakallah to all the other amazing speakers. I'm honored and blessed to be among these other amazing professionals. I'm going to now attempt to share my screen, inshallah. All right, so just like everybody else, I'm going to talk about my role as a general practice physician in the mental health line. And I'm going to speak about community engagement. And I'm also going to talk about the career path in terms of becoming a general practice physician. So to start off with, what does it mean to be a general practice physician? There's different labels that you might come across. You might hear the label internist. You might hear the label general practitioner, primary care physician, family doctor. It all kind of goes hand in hand. And so in terms of becoming a general practice physician, you start off with your basics. You get your high school graduate degree, followed by a 4-year degree, bachelor's degree from a 4-year university or college. And then from there, it's 4 years of medical school. And then you decide what your area of interest is, and that's where residency comes into play. So to be a general practice internal medicine physician, that requires 3 years of residency. I was blessed then afterwards to become a hospital physician. And after years of that, I decided to sort of narrow my scope of practice and got into geriatric medicine. So that means I specifically work with the adult that is greater than 65 years old. So as mentioned previously, the early part of my career, I was a hospital physician. So that meant I only saw people who were sick enough to go to the hospital. So a majority of the cases that I saw were the results of people not having a primary care doctor or engaging with one. And what I mean by that is I would see people who would come in with a devastating stroke resulting in significant paralysis. And it was usually due to the fact that they had a high blood pressure, but it wasn't diagnosed. Or I would have someone who would come in a coma-like state, and it was related to the fact that they had diabetes that went undiagnosed/untreated. Working downtown in Columbus, Ohio at Grant Medical Center, unfortunately, the last few years of my hospital career, majority of what I saw was drug overdoses. And unfortunately, it was from substance abuse that just went undetected. And so the reason I bring this up is it all comes down to prevention. And so there's certain key points that I'm going to hopefully try to drive home with all of you. And if you remember any of these, I've done my job. So what I really want to focus on right now is prevention. Famous quote, an ounce of prevention is worth a pound of cure. And as we can see with the current state of affairs, with the pandemic that we're currently dealing with, wearing the mask. Does the mask cure you from COVID? No, but wearing the mask prevents transmission and it decreases your risk of getting COVID. So prevention is key. And so I feel like as a society, and again, from what I saw as a hospital physician, it was all reactive. As a society, we sort of react, and I feel like we kind of need to move away from that, and we need to move towards pro-action. And what I mean by that is taking action that initiates change, specifically when it comes to mental health, and specifically when it comes to mental health in the Muslim community, because I feel like it's such a taboo subject. No one wants to talk about it. No one wants to bring it up. You want to, brush it underneath the carpet. God forbid you mentioned that your son or your daughter might have depression. It's looked down upon, and it shouldn't be. And so I'm really grateful to be a part of this. And I have to say much credit towards Dr. Sundus Assad for driving this, for taking this initiative to start this very crucial conversation, specifically at the masjid community level, because this is where it needs to start. We need to have these conversations, and inshallah, this webinar is just a starting step to a continuum of this crucial conversation. So like I mentioned before, it's all about prevention and proaction. We got to take this idea and we got to keep moving with it. So when it comes to primary care physician, ideally, it's someone that you would see regularly, hopefully establish a relationship with. And, it would be the starting point for bringing your concerns about mental health. But unfortunately, what I see, like I mentioned before, as a primary care doctor, most people, young adults as well as old adults, typically don't see their doctor unless there's something wrong. I have a headache, my stomach's been hurting, I've been coughing. So what I want to really focus on is that in order to take care of ourselves and our family members, we really need to see and establish a relationship with a primary care doctor. When it comes to the primary care doctor, just like with any other medical diagnoses, be it diabetes, high blood pressure, depression, it's something that has to be looked for. Nobody walks into my office and says, hey, I have diabetes. It's based on me asking specific questions and then ordering a blood test to confirm it. And the same goes for depression. It's asking about some specific screening questions, and then from there doing a formal assessment to, diagnose and, possibly treat. So my second driving point is that it has to be detected, it has to be looked for. Just because someone looks happy doesn't mean they don't have depression. No one wears a hat that says I have diabetes. No one has a label on them that I have depression. It has to be looked for. And, I'm hoping as community members, we can reach out to people and really, truly reach out to people. Meaning when you say, how are you? Really mean that, like, how are you? Really make that sort of connection. So moving along, as I mentioned before, I just recently switched to specializing in the geriatric population. And so that's people 65 and older. I have to say, working with this population, my average age is probably in the mid 80s. My eldest patient right now is 104 years old. So I love this population. I'm passionate about this population. I've learned so much, and I'm just honored to work with this population. And I feel like, unfortunately, it's a population that's neglected. And no one wants to talk about them. No one really wants to listen to them. And I feel like we sort of lost that connection. So when it comes to the geriatric population, we have the baby boomers that are like aging. And because of advances in medical technology, people are living longer. So when it comes to the different population, people 85 and older are actually the fastest growing segment of this population here in the US. And when it comes to growing older, obviously there's changes. Obviously there's medical conditions, but depression is not a natural part of aging. Just because you're older, you're not not expected to be depressed. People would assume you would be because, you know, you can't hear as well, you can't, you know, see as well, but it's not a natural part of aging. And then globally, you know, mental health doesn't discriminate against, you know, your religion or your age, or your culture. So globally, unfortunately, suicide rates are actually highest in the people who are 70 years old and older. I'm just going to touch briefly on this because I feel like it's a topic, again, that we don't normally talk about. And I know some people had mentioned, you know, certain symptoms, you don't think of them as depression. You know, it isn't someone that, you know, is like Eeyore from Winnie the Pooh, you know, they don't have that glum face. You know, they could actually be the happiest person in the room, you know. So when it comes to the geriatric population, it's certain symptoms, you know, such as fatigue or difficulty sleeping or difficulty concentrating, that I feel like sometimes get often overlooked because everyone has just assumed that it's related to your diabetes, it's related to your heart disease, but it actually could be depression. And again, like I mentioned before, has to be detected. As we age, you know, the risk of, or the chances of having a chronic medical condition sort of come hand in hand. And what I mean by that is if you have depression, you know, you're not eating well, you're not taking care of yourself, you're not exercising, it increases your risk of a chronic medical condition such as a heart attack or a stroke, and vice versa. So if you actually develop a stroke, that increases your risk of depression, so much so that there's been so much research and data behind it that when you actually admitted to the hospital with the stroke, while you're undergoing the evaluation and the treatment started, you know, you're started on your aspirin, you're started on your blood pressure medicines, you're actually started on an antidepressant in the hospital. So like I said, they go hand in hand. And, you know, with the older population, that's one of the things we really have to think about. Given the elderly population and the type of symptoms they might have, their symptoms, depression might be so severe, specifically in terms of lacking concentration, lacking focus, the inability to make decisions, that people often misdiagnose them as dementia. So those are some key things to kind of, you know, watch out for with the older population. When it comes to thinking about depression, you know, I think someone had mentioned about things to kind of look out for. So there's obviously risk factors for developing depression like there are for other medical conditions. So when it comes to depression, some of the risk factors, obviously they're common with the younger adult. So being female, unmarried, being of the lower socioeconomic status, having a chronic medical illness, social isolation, which we're all experiencing right now, given this pandemic. A family history of depression also increases the risk, and then any sort of substance abuse. Moving on to the older adult, you have those similar, like I mentioned, to the younger adult, but for the older adult, unfortunately, there's other risk factors that come into play. Loss and grief, you know, as we age, we're losing loved ones, we're losing peers. So having to deal with that grief on top of everything else. There's the loneliness factor, and that's what I'm seeing a lot of. I mean, unfortunately, the residents and the patients that I see, they may not be dying from COVID, but they're dying from the isolation of COVID. You know, they're restricted to their rooms. Family members can't visit them. I've seen a significant decline in people in terms of mentally and physically because of the loneliness. As we age, you know, you think of couples that have been together for quite some time, there's that caregiver burden. You know, if you have one of the spouses that develops a chronic medical condition and can't do for himself, the other person has to sort of pick up that slack, and that leads to increased physical as well as mental stress. Cognitive impairment is huge, specifically the ones that are just on the cusp of developing dementia. You know, you get to a point and you're starting to recognize that I can't think as quickly as I do. I'm not remembering, you know, where I put my keys. I'm not remembering people's names. You know, so once you develop that awareness of your limitation, that increases your risk of depression. You know, unfortunately, the older that we get, the risk of developing chronic medical conditions increases. And so age greater than 75, they have a higher risk of depression. And then again, going along with the current situation, poor social support. I mean, they're losing peers, you know, as they age, more and more of their friends are passing away, and you know, not having that social support is really huge in terms of them being lonely and not feeling valued. And then obviously, as you're older, compared to when you're 20 and 30, you start thinking about death, and there's that fear and anxiety that goes along with that. So it's something that's more unique to the elderly population. So when it comes to that treatment, I think a lot of the other specialists, touched upon it. And what I'm hoping that everyone can appreciate, mental health is so vast that it requires a collaborative effort from different professionals. It's not like it's not like a one-stop shop. I mean, you take the medication, you follow with your psychologist, you get the support from your counselors, you go to your mom, you go to your chaplains. There's a whole vast support system out there, but it's a matter of understanding it and utilizing it. And I think that's where other people need to sort of help engage. And I'm hoping with these continued conversations, people recognize the fact that, we shouldn't put all the responsibility of, these people reaching out. We as community members should reach out to others. One of the things I'm going to touch upon, because we have been dealing with a lot of social isolation, is that technology now has come into play, specifically with the elderly population. It's been good and bad. Like I said, I work in environments where they can't have visitors, they can't have their family members. So they're sort of learning this new way of socializing, using iPads to visit with loved ones. I know in the hospitals, there have been initiatives for getting more iPads because unfortunately family members can't visit. And the same thing with this residential facilities, they're using iPads, to socialize. And aside from a social perspective, they're also using iPads from a medical standpoint. They can't leave their buildings to go see their cardiologist. So there's a lot of telehealth. So technology can be good, and, it can be kind of not bad in the sense, but, the elderly population, they're not used to socializing virtually. They're used to that genuine face-to-face contact. So it doesn't replace that. And so, but that's the best that we have right now. So the third and final point before I'm done with my presentation is to talk about community engagement, to talk about us as Muslims. Our Deen, we are so blessed to have our Deen. Our Deen teaches us about being brothers and sisters, but I feel like that's more verbiage, and we need to take that being brothers and sisters and we need to put that into action. And so we've all heard the saying, it takes a village to raise a child. And I'm speaking for myself. I find that to be absolutely true. I'm trying to raise my kids with Islamic beliefs in a society that goes against it. And, in a country that, obviously Islam's not the majority. So it's hard. So I seek out, certain like-minded people. So my children can recognize and realize they're not the only ones that have different beliefs than everybody else. So just as there is a village to raise a child, it takes a community to support the elderly. This is a extremely vulnerable portion of our community that I feel like unfortunately gets neglected. And I feel like we need to be the ones, the community members need to be the ones to reach out, whether it's a phone call, if it's a text. I mean, I know we're sort of restricted in terms of how we can engage. It could just be a matter of knocking on their door, standing 6 feet back, and just talking to them and just checking in and making sure they're doing okay. And I have to give credit. I mean, I've seen some initiatives with the newer community specifically. I remember when COVID started, someone had mentioned, starting grocery shopping for the elderly, to kind of reach out. I've actually had a friend of mine who started a program called STARS, literally STARS. So Seniors Together After Retirement Saturdays. And literally it was just a matter of getting senior citizens together and engaged in, social interaction. And my last and final piece in terms of talking about that, the reason I bring that up is that these sort of initiatives are protective factors in terms of when it comes to mental health, specifically depression for the elderly. I mean, we as a community need to reach out and, provide that social support, with friends and families and community members, providing the social activities. I mean, alhamdulillah, we're blessed where we are, but I miss the masjid. I miss Jummah. I miss seeing people. And our masajid provide an area where we can meet and connect. And I feel like our Deen promotes community. We pray in congregation, there's blessing in congregations. So these are protective factors, the social supports, the social activities, volunteering, community service. I help co-head a youth group, and one of the things that we did was intergenerational programming where we, put the youth along with the elderly together, and we would make blankets, for community service. Exercise is huge. I mean, we can't talk enough about exercise. We all know the physical benefits, but there's so many more mental benefits when it comes to exercise, walking, hiking, whatnot. And then there's actually been a lot of research and data in terms of how religion and spirituality comes into play as far as providing meaning and purpose to one's life, despite undergoing losses and challenges. And then also, it provides that social connection. I know, speaking personally, my in-laws, Jummah was their thing. They would get together, they pray Jummah, and then they would find their peers and their friends, and they would go out to lunch. I mean, it provides that sort of social connectedness. So if you remember anything from my talk, I'm going to wrap up now, is those three things: that prevention is huge, and proaction, and then detection. It's something you have to look out for, so check in with your friends. When you say, how are you, really mean, how are you? Ask them specifics. And number three, be engaged, be the one to reach out. We can't expect the one suffering to always be the ones to reach out. We say, hey, if you're feeling sad, call this number. Hey, if you're feeling suicidal, text. I mean, it's great we have those resources, but I feel like as a community, we should be the ones to reach out and really check in on people. All right, I think I'm done. Jazakallah khair for your time, and appreciate everything.
Thank you so much, Dr. Chaudhry. It's very difficult to have so many speakers try to speak in such a small amount of time when you're all this great, mashallah, but we hope that this is the start of many, many talks for all of you. We will be moving forward to our next speaker. We have Nasiba Aiden with us. Nasiba is a certified school counselor at Sunrise Academy. She currently develops high school academic programs and provides social emotional learning for economically disadvantaged students. She earned her master's degree in school counseling at University of Little Rock, Arkansas. In 2017, she moved to Columbus, Ohio from Houston. Her personal goal is doing her best to serve the peace in the world. Her motto to reach this goal is a quote from Rumi: "You are not a drop in the ocean, you are the entire ocean in a drop." She also has expertise in college and career counseling and gifted and talented education. She is currently interested in learning motivational interviewing and play therapy. In her free time, she enjoys playing soccer, field and table tennis, biking, exploring the world through her books and trips. Thank you for joining us, Nasiba, and the mic is yours.
Thanks. Thank you, Nurul Huda. Assalamu alaikum wa rahmatullahi wa barakatuh. First and foremost, I would like to thank the Education Department and the Family and Youth Institute for organizing this event. Secondly, I would like to thank to presenters for sharing their valuable thoughts and knowledge with us tonight. And also, I would like to thank for participants for having us tonight. So inshallah, I will talk about school counseling as a profession in general. And secondly, we'll talk about school counselor and student mental health. The third, I will talk about roadmap to school counselor as a career. So since 1952, ASCA, the American School Counselor Association, has been supporting school counselors. Historically, guidance counselor was used to refer to counselors working in the schools. The job titles you see on the table, such as school counselor, guidance counselor, career counselor, college counselor, are commonly used to refer to school counselors due to their wide range of duties. This term has evolved to school counselor by years. ASCA encouraged the use of school counselor as a title to more accurately reflect the role. Although ASCA recommends a 250:1 ratio of students to school counselors, the national average is actually 430:1 for the 2018 and 19 school year. Why do we need school counselors? ASCA tagline is to build better humans. But what does it really look like? School counselors are focused on the whole child by focusing on 3 primary areas with students. Their academic development, their career development, and also their social and emotional development. And how this work has been done has greatly shifted over the years. School counselors are today based their work on the ASCA national model that you see here. It provides the framework for school counseling program. School counselors have very powerful impact on students. So it is not the guidance counselor of old, reactive, who sits around, maybe waiting for students to come in the office, who may have disciplinary issues or who may just be interested in that college admission piece. Today's school counselors work with all students in a school, and that work happens in a variety of ways. Some of them are through classroom instruction, some of them are through small group work, appraisal and advisement, and one-on-one counseling. Why do we need other partners in that? School counselors do not provide therapy. They do not provide therapy. They do not provide long-term counseling intervention. And that's why we need community partners. This collaboration and partnership is so important because we know students are coming to school with more and more issues. There are a lot of anxiety issues, a lot of mental health concerns. We do have a system in the school to support this, but the fact is this work can be done alone. The multi-tiered system of support is a framework that supports school improvement. There are tier 1, tier 2, and tier 3 levels. This systematic approach looks at the school as a whole, rather than the individual student. When we talk about school counselors doing work with all students, this is tier 1 level, as you see on the screen, which is prevention level. School counselors primarily work at tier 1 level. And that comes about through classroom instruction that counselors do. And then when you look at tier 2 and tier 3, there are more targeted and intensive work. As we look at getting to tier 3 intervention, that is where we are having collaborative relationship with outside agencies. Students' unmet mental health needs can be a significant obstacle to students' academic, career, and social emotional development, and even threaten school safety. Research indicates 20% of students are in need of mental health service, and only 4% of these students receive the necessary services. The fact that 70 to 80% of school-age children receive mental health in school setting. School counselors are trained to recognize and respond to the need for mental health services. Their role in, their role in mental health is mostly prevention and increasing mental health awareness. School counselors educate school staff and parents how to look for warning signs. They deliver instruction into the classroom so students themselves can be aware of warning signs and to cultivate attitudes and skills that promote success, such as resiliency, grit, and growth mindset. Warning signs including mood changes in school performance and attendance, increased disciplinary problems at school, problems at home or with family situation, such as diverse substance abuse, domestic violence, exposure to poverty conditions. They also do, school counselors also do short-term counseling intervention to students who are engaging in harmful or risky behaviors. School counselors protect a student's information he/she disclosed during counseling, except there is a clear and present danger to the student and or to other persons. roadmap to school counselor as a career. There are 5 steps need to be done to become a school counselor, actually. The first one is to earn a 4-year undergraduate degree. A bachelor's in education, psychology, or sociology will be best prepare you for your graduate schoolwork. But if you already earn a bachelor degree in another field, that's okay. For some states, it is required that a school counselor be an educator within a school before they can become certified. The second step is you will need a Master of Education in Counseling. Typical coursework for these degree programs include counseling theories, learning and behavior disorders, human development, and counseling ethics. During your master's degree in school counseling program, you will need to complete graduate supervised internship and practicum experience in schools under a certified licensed school counselor. Some states or school counseling programs require the passing of recognized examination for graduation or certification. After you have passed the required exams, you are ready to apply for licensure or certification. Make sure to review your state's application requirements before applying. Based on the Bureau of Labor Statistics, employment of school counselors is projected to grow 8% from 2018 to 2028. The average salary is $61,000. I am end of my presentation. I will be around for answering your questions. Thanks for having me.
Thank you so much for joining us and sharing your expertise with us. We will be having our final speaker now, and then moving to the Q&A session afterwards. So for our last speaker today, we have Dr. Samira Ahmed from the FYI. Thank you for joining us, Dr. Ahmed. Dr. Ahmed holds a PhD in clinical psychology, has a private clinical practice in Canton, Michigan, and has taught classes at a variety of universities across the nation. She is known for her contributions in promoting Muslim mental health through the publication of Counseling Muslims, Handbook of Mental Health Issues and Interventions, the most cited internationally known academic book on Muslim mental health. Dr. Ahmed is a leading expert on American Muslim youth and has produced numerous groundbreaking publications, including The State of American Muslim Youth, Uplifting Black Muslim Youth, Prevalence of Risk Behaviors of U.S. Muslim College Students, and Alcohol Use Among U.S. Muslim College Students. She also serves as associate editor of the Journal of Muslim Mental Health and mentors up and oncoming Muslim mental health researchers. Dr. Ahmed has been invited as a matter expert to events organized by the White House, Health and Human Services, Substance Abuse Mental Health Service Administration, and the Department of Education, and has been cited in numerous media outlets, including the New York Times, the Washington Post, and the Atlantic. Dr. Ahmed has been a community activist at both the grassroots and national levels for over 30 years, including serving as vice president for MSA National and as a board member of the Muslim American Society. Thank you so much, Dr. Ahmed. I know no bio can do you justice. The mic is yours.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم الحمد لله رب العالمين الصلاة والسلام على رسول الكريم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي السلام عليكم ورحمة الله وبركاته. It is wonderful to be back in Columbus, even if I'm not there physically, at least virtually, I can feel the love, alhamdulillah. And it was especially nice to be able to listen to Dr. Fatma Chaudhry, who is a dear friend. It was just wonderful to hear your voice and just to hear the knowledge that you had for us. So Jazakallah khair to NICC for inviting me. And I think one of the things that's really special about NICC, we lived in Columbus for 3 years, and it's a community that stole our heart. We even, it's been 4 years since we moved back, and, that is very much our favorite community. Even though I've lived in many different cities, there's just something special about Columbus. So if you've never been in any other community before, or if you're new to the community, really value what you have. Because really there's no other place that I would say is like NICC. So may Allah bless the leaders of the community, and including the health literacy program at NICC, as well as the masjid leadership and all the different community members who make it so special. So Jazakallah khair to all of you. Alhamdulillah. So today, I know we've been talking about different topics related to mental health. And again, one of the reasons why NICC is so special is because it's addressing these issues, and not in a superficial manner, but in a much more deeper, thoughtful manner. And just to even have this panel together and the different components, the school, someone who's in school counseling, geriatric population, and chaplaincy, all of these different areas, it's really important and really highlights the level of depth when we think about mental health. Because as Dr. Chaudhry said earlier, it's not one profession who's going to handle all of these and address these issues. It really is teamwork. And while we've heard from the different professions so far, what I'll be talking about more is from an institutional perspective, right? So we've heard from therapists, we've heard from psychiatrists, we've heard from geriatrics, and school counselors, all different individuals. One of the things that what we find is when you're in the field, and I'm a clinical psychologist as well, one of the things that I recognized early on was there, while there are many issues, because I've been serving in the community, you would have, in situations where individuals may have undiagnosed mental health conditions, or different situations in their relationships, be it their marriage or a relationship with in-laws or your children, they cause a lot of stress or tension. And these issues become larger if you don't address it right away. And so you have these issues coming up within the community, but we're not getting help for it. Right? So what happens oftentimes is we let these issues grow and grow and grow until it explodes. And when it explodes, then we try to figure out, what do we do for help? Where can we go? What do we know? And one of the things that we recognize is that information is there, but we don't use it. And part of the reason why we tend to not use this is that we, one, don't have the education. A lot of times people are undiagnosed for a mental health condition because they don't know, what does depression look like in elderly versus, a teenager versus children versus, a female versus male. The kind of specificities like that intricacy is not known, or recognizing that, we often have understanding of, okay, this is what ADHD looks like. And we have this kind of stereotype of someone who's hyperactive, jumping off the walls and all that in classroom, but then we miss, the young people who are quiet and daydreaming. And so then that individual then, starts doing poorly in school, and that has an impact on their self-esteem. And then they have issues with, depression, and it kind of snowballs into something bigger. When in reality, if we had the education and we had the knowledge, we would be able to ask the questions and go to the professionals to get the help in a timely manner. And so there is serious lack of education that we as a community face. And then there's also stigma, right? There is mental health stigma, which is interesting, I find, because as Muslims, we have such a rich history, rich legacy of contributing to psychology, the field of psychology, starting from the time of the Prophet Sallallahu Alaihi Wasallam, from 600 to probably about 1300 is what's considered the golden age of Islamic psychology. And in this time period, all of the kind of modern mental health theories and applications and interventions, many of them were discussed within the Muslim community, amongst the Muslim scholars. And so we have this faith that really is very positive about mental health, and yet we lack knowledge about it. We lack awareness of our legacy. And so there is a stigma also associated with mental health. And I think though that's really interesting for us to recognize and really to understand that, you have this legacy, you have this lack of education. And then the other thing is, well, even if we're able to address those issues, there are a lot of resources that are needed that need to be tailored to our community needs. If you just think about the marriage process, there's a lot of wisdom that you can get from mainstream resources, but then how do you go about getting married, and what does the process look like? And some of those are faith-based, and so you do need faith-based resources to be developed for the community. And so that's where the Family and Youth Institute comes in. We recognized that these are needs that our community has, that our professionals need when they're serving our community. And our parents, our community leaders, they need to be equipped with this information and resources that are based on science, not on anecdotes, based on clinical evidence and knowledge, based on the realities that integrates our faith and culture. And so the FYI was actually created and formed because we recognized that that gap was there. And we really felt the need that we needed to help empower individuals, either the professionals or parents or community leaders, individuals like yourselves, so that you can help yourself, your families, and your community like NICC. And so when we started this process, we realized, okay, well, if we want to help support our community, what are the things that the community needs? Well, first of all, we're at such a basic initial preliminary stage of our knowledge about the research. And so one of the big aspects of what we're trying to do is conduct original research about the issues that matter to the American Muslim community. What is, for example, the prevalence rate of Muslims using alcohol, right? Particularly young people. And so what that was one of our initial studies, alcohol use amongst Muslims college students. And those findings really opened people's eyes, and people, most individuals were shocked and still are shocked when they see and they recognize that 1 in 2 Muslim college students are drinking alcohol, right? Similarly, when we look at the research of anxiety and depression amongst the American Muslims, we find that 1 in 4 American Muslims are reporting anxiety, and 1/3 of the community are reporting symptoms of depression. This knowledge, the fact that this is really an issue of concern impacting many people in our congregations, in our masjids, makes us realize that, hey, we need to have a department that addresses these issues. And congrats to NICC for recognizing this and being at the forefront of this. Really thinking about, okay, what are we going to do for our community? So really, we need to have that research, and someone needs to be doing that research. And alhamdulillah, FYI is doing the research that are addressing the issues and concerns of the community. But research isn't going to be enough. Like, we need to do something with that research. We need to have resources to help educate ourselves. And as the Prophet ﷺ reminded us, that prevention is better than the cure. And so some of what we're trying to do for that is develop those resources. A couple years back, probably, I don't even remember, it's probably 8 years back, 7 or 8 years back, I remember Dr. Chaudhry had asked me, she said, as a physician, I'm getting these difficult cases. Does FYI have anything on suicide? And at that time I was like, we don't, and we can't find anyone that does. So guess what? We're going to develop these resources. And now, alhamdulillah, we came up with a number of different resources, for somebody who is actively suicidal, for someone who's a friend or a family member of someone who's suicidal, for individuals, if there's a khutbah, what to do with Islamic schools, what can you do? Like, just a ton of resources. And Fatima gets the credit. She gets the reward. She gets the ajr for even asking that question to then get us motivated to develop the resource, which in turn, you know, the community can use. And across the nation, those resources are being used because what we're trying to do is empower you, give you the resources that you need. And so that comes through the second part of what we do, which is resource development. And so, part of that is that, and then we have the FYI has an email listserv that provides, free educational articles, resources, again, tailored towards the Muslim community, to really help them make more informed decisions, and increase their awareness about mental health, parenting, marriage, in terms of really, how to promote youth development. These are all resources that are interconnected to well-being. And so really we focus a lot of time and energy developing those resources as well. And then finally, we also recognize that in addition to kind of prevention resources, we also need to have intervention resources. And so that's one of the reasons why we developed the therapy infographic that recently came out. And, again, alhamdulillah, as the work has improved and increased, we recognize more and more of our community members are recognizing the need for treatment. And with that recognition of the need for treatment, people are having questions. Okay, you've convinced me. I need to get treatment. Now what? Where do I go? How do I get help? And what are questions to ask? And so we developed the therapy infographic, and I can put it in the chat for all of you to look at. But really what it does, it highlights kind of 3 questions. It answers 3 questions. Like, first of all, understanding the importance of therapy. Because sometimes there's a lot of misconceptions of what therapy is and what it's not. And oftentimes people feel like, well, if I just had more iman, if I had more faith in Allah, then, it would be taken care of. Well, that's not how it works, right? The Prophet ﷺ reminded us that you need to tie your camel and trust in Allah. It's a 2-part thing, right? If you don't tie your camel, meaning if you're not doing, making the effort to get the job, to get the help, going to the doctors, going to the therapist, going to the going to the psychologist, going to, your, taking care of your health, getting sleep. If you're not doing all that, it's gonna be hard to get to improve your mental health and well-being, right? And so there, what our iman does, it helps us cope better. It helps us, gives us tools to understand our reality and our priorities and why it's important to get help. But it doesn't negate the fact that you may need to get additional help. And also, if you think about it, why else would the Prophet sallallahu alaihi wasallam encourage us to make dua to prevent depression and anxiety, right? Remember there's dua, Allahumma innaka a'udhu bika min al-hammi wal-hazan, right? Oh Allah, protect me from anxiety and depression. It's because that exists. It's a human condition. It's a human reality. And so it's really important that, we help understand that yes, faith is helpful and can support us in our work, to get better, but it doesn't negate the fact that we do need help. So, I mean, it's sometimes also people think that it's only for people who are extremely serious. And so recognizing that there are many different resources in consideration to really get the help that you can, to get therapy. And then the other 2 areas that we talk about is, searching for a therapist, really listing the, what are the qualifications and considerations that you want to think about, how to make sure about cultural competency. And then recognizing that therapists have different approaches and personalities, and to really, be thoughtful and intentional. Don't just take it, okay, well, it's a cookie cutter approach. That's not how it works with therapy. And so the infographic really helps you through that process of understanding what makes a good therapist, what are the things that should make you stop, what are the different red flags, etc. And the idea that we're really trying to do is, the FYI is part of a movement to improve mental health and wellness amongst American Muslims. And the more we are healthier and have stronger relationships, the more we are able to pass on our deen, live healthier lives, and transform our communities. And so as the Prophet ﷺ reminded us, every one of you is a shepherd and everyone is responsible for his or her flock, right? So the FYI offers you tools, but you are responsible for you, your family and friends and your community to really take those resources and implement it for the benefit for your community. So I would encourage you to use our resources. I will put in the chat box some of the resources I mentioned and how you can sign up. And Jazakallah khair for NICC for inviting us. And inshallah, I think we would like to move to the question and answer sections. Jazakallah khair. Assalamu alaikum.
Thank you so much, Dr. Ahmed, for that content, and it's nice to see you virtually. We will move forward to the Q&A session. We have a lot of questions to address and very little time, but there are, mashallah, some great insight here and speakers that we want to take advantage of while they're with us. I'll start with you, Dr. Ahmed, while you're already talking to us. We have a question addressing you here. It reads, Dr. Ahmed, thank you so much for your love to NICC and Columbus. You are dearly in our hearts. My question to you, with your experience, how do you define a community leader? And do you think that data-driven institutions should influence policies to bring more Muslims into the mental health line?
Sure. There's two different questions, right? So the first question is, who's a community leader, right? And going back to the hadith I just mentioned, that the Prophet ﷺ reminded us, everyone is a shepherd, right? Everyone has some responsibility. You can be the leader of your family if you're a parent. You can be a leader of your peer group. You can be a leader within, your kind of your friendship group. It could be in a masjid. So you could have a formal leadership position, or you don't have to. The idea is, and recognizing is, change happens through relationships. And as Fatima was mentioning, Dr. Chaudhry was mentioning, that it's really important that we don't expect people to come to us to get the help. We have to be in and around the community, being involved, reaching out to people. Someone looks down, something's different, they're not coming. What's going? Just calling people up and asking, how are you doing? What's going on? Just as Dr. Chaudhry was mentioning, if we're able to connect with people and know what their resources are, what we're trying to do at the FYI is raising awareness that, okay, these are resources here. If your loved one needs them, pass it on. It's simple like that. It's just sharing those resources is really what's important to help reduce the stigma and get people on a path towards better mental health and well-being. And I forgot what the second question was.
I already put it for live. Let me go back here. That's how you define a community leader, and how you think that data-driven institutions should influence policies to bring more Muslims into the mental health line.
Absolutely. I mean, that is exactly why we do what we do at the FYI. Growing up, I remember attending a lot of different conventions and conferences, and well-intentioned individuals would share, great theoretical ideas of how to solve the issues of Muslim marriages or solve the issues regarding Muslim youth, and you can pray your depression away. And quite simply, that's not accurate, right? And part of it is really important. If we have the data and we can see, and oftentimes what you'll find is, if you have the data to direct your priorities, that's going to have an impact on your programming at the masjid. If you know that mental health is an issue, which it is, we know from the research that at least probably a third of the community is struggling with mental health issues. So if we're not providing resources to the community that addresses their needs, how are we supporting them? How are we making a difference in their lives? And how is the masjid a place of refuge, a place where people can heal and grow and thrive? So that's all important. Like, we need the data to be able to understand, okay, within that area, what do we need to do?
Thank you, Dr. Ahmed. We do have some questions addressed to our first few speakers for Kinza and Ihsan. We have a question that asks if social workers can be dual licensed.
I don't know that off the top of my head. Is there a way for me to look that up and get that to the person who asked?
Yes, and we can also share the answers or resources in the chat or afterwards on our page, inshallah.
I don't know how like the Ohio board would answer that, but at least from my experience, I've met people who were, like someone was a lawyer at one point in their life and they switched over to social work. But then I've also met people who attended trainings to keep their licensure active, even if they weren't practicing. So I'm guessing it's possible if you kind of just stay on top of your requirements. And then like you're very clear about when you're practicing what.
Mm-hmm.
But
Thank you.
that's just off experience. I don't know exactly. I can try to find out.
Perfect. And we will be sharing those resources if you find any. If any of our other speakers have experience in this field, if social workers can be dual licensed, was the question addressed here.
Dual license in terms of license in like in a different field like law? Or are you talking about dual licensed in some other mental health?
The question was not specific. If the person who asked can send a clarification, we would be able to address that better. But for now, that was the general answer we do have. We'll be moving to a question addressed to Ihsan likely. It asks if it's accurate to call psychologists counselors, or the latter is less specific to the degrees that are necessary to be deemed a psychologist.
So go ahead.
You can go ahead.
No, Ihsan, go ahead. Sorry, I apologize. I didn't.
So it seems for the role of counselors, they are going to conduct therapy. Psychologists are going to conduct therapy. So if you're seeing them for that reason, they're both going to be very skilled and able to help you. Psychologists also can do research. Sometimes they are professors, and so they might have a little bit more variability in the jobs that they hold.
Okay, thank you. We do have some questions that may be addressed at more than one of our speakers. We have one that reads, we hear that counselors, life coaches, mentors, and psychologists, are they interchangeable? And if not, do you think the difference is clear to our communities and healthcare consumers?
I can share my thoughts. There are differences, definitely a huge difference between someone who's a life coach versus a psychologist and the counselor. And so part of it is what we have on the infographic is actually highlights what those differences are. And usually the difference is in terms of training and background. And one of the things that I would highly recommend for people is make sure that if you're seeking therapy, that the individual is licensed in your state, because license means that someone has gone through the educational work, they've gone through the supervision, and you've gone through the training. Unfortunately, what's been happening is we have individuals who are, indicating that they are life coaches, and you can have a life coach and do many other things, but life coach is not trained necessarily to identify mental health issues. And we've had many cases where individuals who had serious mental health issues went to a life coach, and the life coach made things worse. So life coach has a purpose in place, but if you're struggling with mental health issues, you need to see a licensed counselor, social worker, psychologist, psychiatrist, depending on what the issue is.
Thank you, Dr. Ahmed. We have a question directed to Dr. Chaudhry here, asking about the STARS program. They're asking if it's still running, and if so, how someone can connect with them.
So, Assalamu alaikum. So unfortunately, just given the current situation with the pandemic and the elderly population being the most vulnerable with it had to be suspended because it was literally a physical gathering of many different senior citizens together in a room, and we would provide food and ways to sort of communicate and socialize. So just given the pandemic, we've had to cease that for now.
Mm-hmm. Thank you for sharing that, Dr. Chaudhry. We did have some questions that were answered live for those who may not have seen the Q&A box during the webinar. However, I do want to return to some of those answered by Brother Khurram Ahmed and Dr. Shah. We had a question addressed to Brother Khurram asking about females serving as chaplains. And I do want to highlight before you answer that one live that you shared some resources in the chat box here, and we will make sure to share those links with the audience on our social media platforms afterwards if they want to locate them then, inshallah.
Yes, assalamu alaikum again. Absolutely, women are welcome and encouraged in the chaplaincy field. And as I said, in many cases, you can imagine a Muslim patient might feel more comfortable speaking with a female chaplain. So it is definitely an avenue for Muslim women who want to, pursue a career, a well-meaning career in Islamic and Muslim leadership. Absolutely, I would encourage, and inshallah, we'll have many more Muslim women's leaders and teachers. Please encourage your daughters to pursue that.
Thank you. Jazakallah khair for your answer. We have time for, let's say, 2 or 3 more questions. We had a question addressed to Dr. Shah asking if depression has a chemical component, and another question that went into geriatrics. So you may want to cover that, and then maybe Dr. Chaudhry has an input there as well.
Sure. And I apologize. I know before my audio was a little bit soft. Is it better now? Sounds
good to me. I think the speakers can agree. Okay, go ahead.
So the question I believe was, yeah, if depression had a chemical component to it, and the answer I had typed was that it really is situational. It depends on the presentation of the depression, which is why medications and therapy together have been proven to be better than either one alone. So serotonin is a neurotransmitter or chemical that is implicated in depression. It's also implicated in, it's actually implicated in symptoms of depression, such as mood, appetite, sleep, interest. And we have medications that target that neurotransmitter to help regulate some of the symptoms of depression. However, like I mentioned, that therapy and medications both are better than either one alone.
Thank you. Dr. Chaudhry, do you have anything to share for these questions?
Yeah, just to reiterate what Dr. Shah said, there's definitely a chemical component. Specifically for the elderly population, if they do come with me with symptoms of depression or they think they're depressed, I do investigate any other organic pathology for it. I check like their thyroid level, I check like their kidney function, all those other things prior to making a formal diagnosis that this is just depression. I mean, could an older individual just have depression? Absolutely. But given other comorbidities exist, I investigate those as well.
Thank you, Dr. Chaudhry. We have 2 more questions. They're kind of broad, so I would appreciate anyone sharing their input. The first question is from an anonymous attendee asking, I am a high school student going into college next year, and I'm interested in going into psychology and learning more about Islam and combining the 2 in the future. Do you have any suggestions on some ways I could do that as a career? The broad question, but any insight would be helpful. I know Dr. Samira Ahmed selected that she wants to go ahead and answer it first, and then if anyone else would like to pitch in, feel free to.
Yeah, Jazakallah khair for the young person who sent that message in. Absolutely. There is so much you can do. It's unbelievable. And I would encourage you to really go about doing it. You can, start off with your bachelor's, do a double major in psychology and Islamic studies or Near Eastern or Arabic, whatever, OSU kind of department that works for you. There is definitely a need, like I mentioned earlier, if you're more interested in kind of the historical aspects, there's so much work of our early scholars that you could really bring to life because most of it's in Arabic, and so many English speakers aren't aware of that. There is also the importance of really, because Islam is such a psychologically infused deen and way of life. there's a lot of work that needs to be done in kind of helping people see that connection and build that connection. And then even if you think about from a therapy, if you're just if you're interested in doing clinical work, again, you know, in my practice, it's, you know, if my clients, you know, again, you have to be careful because clinically, if your clients want to integrate kind of Islam into therapy, you can integrate it. If they don't, then you can't. But for those who do want it, so much of therapy can be integrated in one's faith, and it makes it much more stronger and more powerful in terms of treatment intervention. And so, absolutely, there's so much you can do.
Thank you, Dr. Ahmed. And we have this and then final question here addressed at Ihsan, and I figure Nasiba might be able to answer this as well. It asks, how should I deal with my peers in the Muslim youth community that openly participate in drinking? I didn't imagine it was that bad until I started meeting more people in college. Should I not interact with them? Should I tell their parents?
Bismillah, this question is difficult because your peers are probably very important to you, and it's important that you interact with them in a way that is, you know, the Prophet ﷺ, he never interacted with people in a judgmental way. And even if you're holding tight to your deen and you're not being judgmental, it can still come off that way. This is a situation that I found myself in as well when I was a bit younger, and I think it's important for you to remember that you have to preserve your deen first. You have to preserve your faith and what is good for increasing your faith and what might be harmful for your faith, and move towards your friends with compassion and non-judgment and love, and try to be a reminder of good things without you know, kind of telling them what they should or should not be doing. And I'm sure you're already a good reminder for them. In terms of telling or not telling their parents, my rule when some of my friends began to kind of go down this path, my rule was, I will never lie to your parents for you, just as I will never lie to my parents. And so if you put me in a position where your parents ask me, I'm going to tell them the truth. And so I would encourage you not to take upon that lie and that deceit with them, because it can be very damaging for you and for your faith to have to live with that.
Thank you, Ihsan. I know this is a question that everybody can relate to at some level. So if any of our other speakers have an input here, please feel free to add your perspective as well.
Can I add something?
Yes, go ahead.
I think that the drinking may cause addiction problem. And later it might be a big problem in those youth life. Therefore, it's important. But since this person is their like friends, I don't know. It is hard. It might be hard to deal with it. But since it may cause addiction, so it is serious. I suggest this person, this person, to be among them and to be a good role model. We need to figure out the reason behind their why they drink. We need to find out the reason. Maybe sometimes if they are having a kind of anxiety, depression, or kind of problems, they may cause them drink. Or there might be other problem. Maybe they are modeling their other peers. So we need to find out the problem, the reason behind this first. If this person thinks that it's not going to cause any problem, he may tell their parents, but their parents may not be educated in this field, or they may act differently, which may worsen the situation. So it may not resolve the problem, because sometimes as a parents, because since drinking is haram and we act very, how do you say, in a negative way. So I don't know if our parents are enough educated to deal with this problem, to respond this drinking problem. If they don't know how to respond this, it may get worse. I don't know if my other colleagues would like to add anything, but I think in this way. Thanks.
Could I add one last thing?
Please go ahead. We would like to
it
hear your
kind-
perspective. on that.
Kind of adding on what Ihsan and Nasiba both have said, when we hear about these situations on campus that we may be facing or within our friends, we often feel overwhelmed and not really sure what to do. But what's interesting, I think, is for us to recognize this is an issue that even the companions struggled with, right? So there's a famous companion, Nu'ayman ibn Amr, who had a drinking issue, right? And so what's amazing is how the Prophet ﷺ dealt with him. Again, Nu'ayman, he had a colorful personality, and he drank alcohol, and he was reprimanded, and he came back to it again, and he was reprimanded again. But the Prophet ﷺ saw him for who he was. He was amongst the Badriyun, meaning he was at Badr. He was at all the battles. He was, he had done a lot for Islam. So he never took that away from him. So one of the times what happened was when the companions got so frustrated with Nu'ayman, because he kept drinking alcohol. Basically, he probably had, he had an addiction, most likely, and he tried to change and wouldn't be able to give up alcohol, and he'd come back to it, and then he'd get the punishment for it. And so one of the companions was so frustrated with him, and he was like, how can you keep doing this? And he said something very rude. And when the Prophet ﷺ heard about it, he was so upset. He was like, no, he was like, no, Nu'ayman loves Allah and his messenger. So going back to what Ihsan was saying, you hate or the behavior, but you love the person, and you have to separate the two. You can love your friend and really want the best for them and help them and talk to them and ask them, what's going on, what's behind it, and all of that. But you don't engage in the behavior, don't support the behavior, you don't hide the behavior, you don't lie for the behavior. And get the help that you can, that you think you can, but don't judge. Don't look down on them, because that judging and that looking down on him or her may push them down the hole even more. And so really remember the story of Nu'ayman, and everybody has different fitnas, everybody has different fights and struggles that they're tested with, and it's really how are we dealing with our struggles that we're going to be held accountable for.
Thank you so much for sharing that, Dr. Ahmed. This question and many others have multiple layers to them when we're talking about mental health. So we hope that the answers we provided have addressed some of that, and we hope that the resources we provided and will continue to provide help you gain access to additional help that you may need or resources that will be helpful to you. I would like to once again extend my extreme gratitude to all of our speakers for joining us today. This is a much needed event for our community and everyone in the world, really. But we are really appreciative that you are working with us, and we're excited for the work that will come out of this, inshallah. I want to emphasize that this webinar is recorded and will be available on the Noor Ohio YouTube channel. And you can find this as well as other resources and mental health line updates on our social media outlets at NICC Education. Please look into that, as well as the resources provided by the FYI. And if you have any questions, comments, or concerns, email education@nurohio.org. And remember us in your du'as. And thank you again to all of our speakers and our attendees. Assalamu alaikum wa rahmatullahi wa barakatuh. Stay healthy and well, inshallah.